Welcome back, everybody. Lovely to see you here so promptly. I'm delighted that everything is running to schedule so far, and the Secretary of State has arrived here safely, and I'm pleased that he's able to join us at our amazing conference today. He's going to speak to us. He's promised to allow some time for questions afterwards, so I would ask you to give a professional and respectful welcome to our Secretary of State for Health for England, Mr. Jeremy Hunt. Jeremy, thank you.
Very much indeed. Well, thank you for a professional and respectful round of applause. Much appreciated. And thank you for inviting me this morning, and thank you for your work as GPs. The truth is that if general practice fails, the NHS fails. It's as simple as that. And I think at the moment, I'm just going to go back from this slide for a moment because we're going to come on to this exciting slide in a moment. Could we just take the slides down for a moment? Thank you. The evidence is that despite enormous pressure, you are continuing to deliver superb care. And I think the recent CQC survey that came out confirming that nearly 90% of practices are delivering good or outstanding care, that 4 in 5 practices that get the lowest scores are improving on re-inspection, the British Social Attitudes Survey that says that GPs have an 85% satisfaction rate, some of the highest amongst all public services in our country, and the evidence on the ground. It's invidious to pick out examples, but if you look at some of the extraordinary innovation that is happening in places like Whitstable or the Great North Care Record, or Modality, or the Hurley Group, some of the IT systems that are beginning to be put in place, there are some really exciting things. But if we're going to have an honest conversation about the challenges and pressures facing general practice, we have to look at those pressures first and recognize that too many of the GPs that I meet are knackered. They are often feeling at the end of their tether. They feel that they're on a hamster wheel of 10-minute appointments, 30 to 40 every day, that seem never-ending. They don't feel able to give the care that they would like to their patients. And increasing numbers of them are choosing to work part-time and, at worst, to leave the profession. And so we have to think really hard about how to stop that happening if we're going to use the magic of general practice to do what we need it to do for the NHS. And that's really what I want to talk about this morning, how we address those issues. And when I became Health Secretary 5 years ago, I was saying to Helen, I think this is the 3rd time I've come to this conference. The usual conversations that people would have with me were about money, and I'm sure we'll have conversations about money when we have our respectful questions later. When I first became a cabinet minister, someone said to me that there's only 2 things that people want from a cabinet minister: money and silence. And of course money matters. But over the last few years, with respect to the NHS, what I've learned is that yes, money matters, but capacity matters massively too. It's fine having the money, but if you haven't got the doctors and nurses to spend the money on, then it's not going to work. And so that is why, after I was reappointed to this job after the 2015 general election, the first of 3 times that I've been reappointed to the job, I announced our plan to recruit an extra 5,000 doctors working in general practice. To be absolutely clear, that is a net target, so we're not talking about 5,000 doctors to replace 5,000 doctors who may be retiring. We're talking about increasing the total size of the general practice workforce from 34,500 to 39,500. And when I announced that, it was the first speech that I gave after that 2015 election. It was met with some enthusiasm and also, it's fair to say, some skepticism. So I want to tell you why, for me, that is a really important target. One of them is because I think the type of work that you're doing has changed profoundly over the last 2 decades, because you are seeing a lot more patients with greater acuity of care needs. And that means that the old model of 10-minute appointments doesn't really work for patients with multiple long-term conditions who may need 30, 40, 50 minutes to actually get to the bottom of all their needs. The second reason is because so many GPs were talking to me about the problem of burnout. And in the end, there is a mismatch between the work that we're asking GPs to do and the number of GPs that we have to do that work. And that is one of the root causes of that burnout, and we absolutely have to address that. But there are also a couple of strategic reasons why I wanted to give GPs the biggest proportional increase of any major chunk of the NHS workforce. In fact, one of the biggest increases in GP numbers in the history of the NHS. And that is because if our health system is going to become sustainable, like health systems all over the world, we have to move to a model where we value prevention as much as cure. And GPs are on the front line of that transformation. This is the whole thinking behind the 5-year forward view, the STPs. We're just not going to be able to deliver that profound change in culture unless we back our GP workforce to do what we need them to do. And then there's a fourth reason, which relates, I think, to what Helen was talking about this morning when she talked about the values of the profession. I'm not a doctor, so I can only speak as a patient. But for me, the best thing about the NHS is having a doctor who knows you and your family. Continuity of care, which is the professional word that you use, is incredibly important to us as patients. And it's why we value our GPs, and it's why we love the NHS. And people from health systems all over the world that don't have the developed primary care networks that we have, don't have continuity of care, are asking themselves how they can set those systems up. And I think you tell me that continuity of care matters for professional reasons as well. As GPs, you are generalists, and you're having to make judgments, principally the judgment as to how ill someone is and whether they need hospital treatment. But knowing the context of someone's family circumstances, indeed knowing other people in their family, can be very helpful in making those judgments. But the truth is, because we have underinvested in general practice over decades, we have made it much, much harder for you to deliver the continuity of care, which I think is at the heart of the magic of general practice. And I want to turn that around. And I recognise that I can't do that unless we get more capacity into the system. So that's why we have stuck with our plan to get 5,000 more doctors working in general practice. And I want to look this morning at how we're doing with respect to that plan. I think the truth is that it's a mixed picture. But let's start with the good news, which is in fact that slide that was up just a moment ago. And let's see if there we are. So we said, if you look at this slide, that we needed to significantly increase the number of medical school graduates who are going into general practice to around 3,250 a year. That's about half of all medical school graduates that we are looking now to go into general practice. And as you can see, we are doing pretty well. The numbers of medical school graduates going to general practice up 9% since 2015 when we announced that ambition. We're 41 higher at this stage than we were at the same time last year. We've got 518 to go to get us up to the 3,250 level. We are reasonably confident that we'll do that, although there's going to be a lot of work necessary to get to that target. But this has been something that has been greatly to the credit of Health Education England. And we're not stopping there. As you will know, a year ago, I announced that we needed to have a 25% increase in the number of medical school places, full stop. We simply need more doctors in the NHS when you look at what's coming down the train track in terms of the ageing population. But we're not just saying that we want 1,500 more medical school graduates every year compared to what we had before in England. We're saying we're going to need those graduates to go into what we loosely call the out-of-hospital professions, but general practice and psychiatry in particular. And so when we announce in the spring which proposals have been accepted for the remaining 1,000 of those 1,500 extra places, one of the key criterion is how good your courses are at training people for general practice and community work. That is one of the 4 key criterion against which all the medical school applications are being assessed. So that has been, I think, relatively successful. However, we recognise that it takes time to get people through medical school. Every time I hear people coughing, I worry about last week's Conservative Party conference. So I just got over my cough, but I'm going to hope that actually there are a few doctors here, aren't there? So I should be all right. There's a time lag before these graduates will come through into general practice, and so in order to breach that gap, we're going to need to do some international recruitment. And NHS England have announced plans to recruit 2,000 GPs internationally, and you can see some of the plans here. We are going to focus initially on EEA European countries because their qualifications are automatically recognised by the GMC, so it's more straightforward. NHS England are going to open an international recruitment office for the first time next month. And we already have 601 applications approved, which is an encouraging start. And we're also going to look at our non-EEA recruitment to see whether there's anything we can do to reduce the bureaucracy associated with people who are wanting to come to the NHS from further afield. So I think that is also encouraging. But let's now look at where things have been less encouraging. Because since we announced that ambition, we've also seen a disappointing increase in the number of GPs who want to leave the profession. In fact, if you look at the graphs, you can see that the number of GPs who want to leave the profession is actually at the highest level it's been since 1998. And if you just look at the GPs aged 50 or over who want to leave the profession, that now equates to 7,000 GPs. And we can't afford to let that happen. We need those valuable skills. These are highly experienced people who have an enormous amount to contribute to the NHS. And that is obviously a cause of great concern. And then we also have the issue of geographical diversity. We can see that there are parts of the country where it is particularly underdoctored. The numbers of doctors are low relative to population need. And there are other parts of the country where it's particularly hard to attract trainees to go and work. And there are some parts of the country like the West Midlands, Yorkshire and Humberside, and East Kent, which actually score badly on both counts. And so we have to look at that geographical diversity issue as a matter of great urgency. So those are the challenges. And the question is then how we address those challenges. And let's start with that question that we talked about just now, which is the issue of funding. Because I think the message that you gave me 2 years ago was twofold. You said that you wanted an inspiring vision for general practice that would make young doctors want to choose general practice as their NHS career. But you also said that you needed that vision to be backed with the cash that will give it the credibility that it was really going to be delivered. So let's just have a look at what's happened on general practice funding. If you look at the red line, this is the proportion of all NHS funding that has gone into general practice. And as you can see, it fell for the first 2 years of my government. In fact, it has been falling since 2005. Since then, it's increased from 8% to just under 10%, which is the highest proportion for a decade. When we get to 2020-21, it will be getting on towards the highest ever proportion of NHS funding. In terms of real terms, cash, that's gone up now for the last 4 years in a row. But I know that's not what it feels like on the ground. And a lot of people say that we can see these numbers being talked about, but on the ground it doesn't feel like that in our individual surgeries. So let me give you some examples of the things that money is going into. So £30 million is going into the Releasing Time to Care programme. Another £30 million is going into keeping down your indemnity costs, which I know are a serious issue and I'm going to talk about later more. We have now nearly 400 clinical pharmacists operating in 650 practices across the country. They are being funded, and we've got £20 million already that's been spent in the Practice Resilience Programme and the Vulnerable Practices Programme. But I think the heart of the reason why you don't feel the increase in funding, which is actually coming through when you look at the hard numbers, is because at the same time as the funding increasing, the pressures have also been increasing. And like the rest of the NHS, the pressures have been increasing at a faster rate than the funding has been increasing to match it. And so that's why it doesn't actually feel that way. And that is why we have to look at this issue of capacity. Now, we talked about the capacity in terms of GPs, but of course, support staff really matter. As you know, our ambition is not just an extra 5,000 doctors working in general practice, it's an extra 5,000 support staff. So that number in the GP forward view, which is what sits behind all these increases in funding, talked about an extra 3,000 mental health therapists, an extra 1,500 clinical pharmacists, an extra 1,000 physicians associates. And in terms of the progress, we've seen 2,700 additional non-GP practice staff since September 2015. So we're more than halfway towards our target of 5,000, which is encouraging. But we also have to look at the question of burnout. And this is something where I need your help. So there are things that I can do and that I want to do and that I'm trying to do in terms of funding, in terms of capacity, in terms of the long-term solutions. But there are also things that you in your individual practices can do that will make a huge difference. And if you look at the pilots that we've been having in 20 CCGs in the Releasing Time to Care programme, we are actually seeing some very encouraging results. The heart of that programme is to try and look at the 26% of GP appointments that GPs themselves say are potentially avoidable. And if you look at the 10 high-impact actions as part of that Releasing Time to Care programme, we can see that, for example, active signposting can reduce GP appointments, avoidable GP appointments by between 5 and 15%. Up to 10% of GP appointments can be diverted to pharmacists. If you do consultations online, between 60, this surprised me actually, between 60 and 80% of issues can be resolved without a face-to-face appointment being necessary. And overall, in the practices that have tried this, they have found that they can release between 45 and 60 minutes per GP per day by the reduction in administration, the reduction of avoidable appointments. And for our patients, that is very important because, of course, what that does is means that you have more time to spend on your most vulnerable patients. You have time to have longer appointments with patients who need it. And also you have the energy to do your jobs in the way that you need to. Now, the figure at the bottom, I think, is important here because in terms of the optimism quotient, which is not always especially high in general practice, I've noticed, that people who do this program, we see that before the program, 12% were optimistic or very optimistic that their practice could cope with their workload over the following year. That actually increased to 73% after they tried it. So we are going to roll out this program because we think it really can make a very, very big difference. And we want to support you in doing that. Now, there are some other things that I want to do as well that can help release the pressure on general practice. And I just want to talk about some of the things that I'm going to announce today. The first is that we are making a lot of progress in terms of technology developments. We know that booking appointments online can save your surgeries time. We know that people who order repeat prescriptions online can also save you time. Next year, NHS England have promised that every NHS patient will be able to access their record online through an app, which will be, I think, which will lead to a big increase in the number of people who are booking appointments online and booking their repeat prescriptions online as well. And I think that will help to reduce the workload pressures on the admin side. I want to go back to the issue of recruiting in hard-to-reach areas. We have been piloting a scheme which gives a £20,000 salary supplement to trainee doctors who go to areas which have been unable to fill a trainee place for 3 or more years. We've done this on 126 times. We've had an 86% success rate in this program. So we're going to expand that program, and we're going to do that for 200 doctors every year. And that will make a real difference in places where there's just been an absolute nightmare in terms of actually getting new doctors in. And we think that will make a very big difference. But on top of that, when we make our decision as to which medical schools will be set up or will expand to deal with the expansion in doctor training that is going to happen, we aren't just, as one of our key criterion, going to be choosing places that will steer people into general practice, but we're also going to have a big effort to favour, as one of our key criterion, medical schools that will help us send doctors to hard-to-recruit areas. And we know there's a lot of evidence that the way to get doctors to go to hard-to-recruit areas is to recruit medical school graduates from hard-to-recruit areas. And we've made that very clear to the medical schools that we will be assessing. And we hope that will make a serious difference. Now, I know that another very big issue for you has been the fluctuations, the variability, and the cost of indemnity. We see that now rising to around £8,000 per GP. And I have decided, after a lot of careful analysis, that we need to introduce a state-backed indemnity scheme program for general practice. This is going to take time to introduce. It will take us 18 months. We need to negotiate with the medical defence organisations. We need to be also negotiate with the BMA. We will introduce those discussions in this year's GP contract discussions, but we will need to finalise it when we actually know the numbers in next year's GP contract discussions, so that the scheme, I hope, will start in April 2019. But the intention in doing this is to have a scheme that is more affordable and more dependable and reliable for you. And the great advantage of a state-backed scheme is that we have control of a number of the variables that in the current system have caused the cost of indemnity schemes both to fluctuate and to increase very significantly. And a number of people have said to me that the problems around indemnity schemes are one of the main reasons that is tipping GPs approaching retirement to decide to retire early and leave the profession. And I hope this will give some stability that will mean that that doesn't happen. We also will be rolling out pilots of the GP Careers Plus program, which is a program that is specifically designed to target GPs who are approaching retirement, who want to work flexibly, who want to be involved in mentoring roles. And those GPs, under this program, where we've piloted it in Great Yarmouth and Somerset, it's been extremely successful. And so that's what we will be rolling out as well. And then the other really important thing that I want to announce today is around the role of physicians' associates. A number of you have said that whilst you welcome the use of physicians' associates, what would make them even more value in your practices is if they were able to do things like order x-rays or prescribe from a limited list of medicines. And to do that, they need to be regulated. And so today I can announce that we will be consulting on the professional regulation of physicians' associates. And that will mean that as we start to expand the number of physicians' associates in the NHS, but especially in general practice, they can be a lot more use and support to you. We need to be clear that they are not replacing the work done by GPs and that they are operating under the supervision of GPs. But we also need, as we expand the number of GPs, to leverage your time better. And where there are things that can be done by other trained, regulated clinical professionals, then we should always look to how that can be done. Let me finish by saying this. There isn't a silver bullet to the problems and the challenges facing general practice. But we do have a plan. We are implementing that plan. And at the heart of that is not just an increase in funding, but it's also an expansion of capacity. And we are absolutely committed to this plan, not just because we want to support you, but because this is fundamental to the changes that we need to see in the NHS. I want to show you this graph to finish off with. This is what the Commonwealth Fund said in July. They rank us every few years against other healthcare systems across the world. As you will know, in July, for the second time running, they said that we were the best and safest healthcare system in the world. But what were the reasons that they said we were the best? They said we were the best at patient engagement and care planning for our patients. Well, who does the majority of that care planning and that patient engagement for the 1 million people who use the NHS every 36 hours? It's our GPs. They said that we were the best in the world for equity. Well, who are the people who are available for every single person in our society, whoever they are, whatever challenges they face? Who are the people who see them free of charge the whole time? It's our GPs. And they also said that we were one of the best in the world for access. Well, who are the people who are delivering 300 million appointments every year, making sure that people who need to can get to see a health professional quickly? It's our GPs. So if we want the NHS to remain the best in the world, then we have to back our GPs to do their job. And that's what I'm determined to do. Thank you very much.
Thank you very much, Jeremy. Can we have the house lights up, please? And Ladies and gentlemen, I am conscious timing is very tight. I am sure that the Secretary of State in that announcement-packed speech will have generated a lot of questions and energy from you. But I am conscious that probably indemnity is the one thing that's made everyone's ears prick up most keenly. And so while people are queuing up, I'd like to invite the chair of the GPC, Richard Vaughtry, because I know he's here in the audience. Perhaps he and I will perhaps ask you a couple of questions on indemnity so that other people don't have to, because partly we know that it's a very early announcement. There's not a huge amount to be said just yet, other than we welcome it. Can I just check with you? Hi, Richard. So a state-backed indemnity scheme. So does that mean the GPs will not need their own indemnity cover?
It doesn't mean that there won't be any requirement for indemnity cover, but we want to match what we do in the hospital sector, whereby, because we are in control of things like the discount rate, we can have a much, much better control of the costs of indemnity, and we can bring those costs down. And so we are confident that we will be able to deliver a system that is more predictable and more affordable. We need to conclude negotiations with the MDOs, particularly over things like historic liabilities.
The medical defence organisations, yeah.
Yeah, particularly over things like historic liabilities. But essentially, we have concluded that this will be a much lower cost way, both for the NHS and GPs. And this may not be the moment to conclude the GP contract negotiations, Richard, but I'm looking forward to productive discussions with you as to how we might do that.
Thank you very much, Secretary. Is this on?
Yeah.
Yeah. Thank you very much, Secretary of State. We welcome the commitment you've made today. I think that's taken some significant work between ourselves and the college and other organisations to get to the stage where we are today. We know there's a lot of work to be done. Yeah. But I think just for today, it'd be helpful if you could give us an assurance that the commitment for a state-backed scheme will include all GPs providing NHS care. So this is partners, sessional GPs, locum GPs, whether you're working in an out-of-hours setting, whether you're working in your practice. Is this about the whole of general practice and their staff?
Indeed.
So that we can ensure that we can provide comprehensive care to our patients day and night?
I can give the commitment that it will be for all doctors working in general practice. Yeah. The wider commitments I would love to be able to give you, but I don't know the answer, so I'm not going to say something that I have to retract later. But it is for doctors working in general practice. It's not just for partners.
So this is locums, sessional GPs and partners. Yes.
That's what I want to do.
Brilliant. That's a great step forward. I'm conscious we now have about 5... The timer tells me we have 60 seconds left before the Secretary.
I can spend a bit longer if you can.
That would be great. What I'm going to try and do now is I'm going to take 2 questions, one after another. I would ask people asking questions to be succinct, snappy, and ask a question, but please introduce yourselves. I'll ask microphone 4. We'll start with you, please. That's you at the back. Yeah. Pink shirt.
Can you hear me? Yes.
Yeah.
Hello, Mr. Hunt. Thanks for coming today. My name's Carter Singh. I'm a GP in Nottinghamshire, in a very deprived area. I completely get that no health secretary is ever going to commit career suicide by having an open and honest, frank discussion with GPs or the population about how bad things are, because ultimately this kind of thing doesn't win votes. But until we drop the strap lines and have this discussion and take the first step in acknowledging how bad the situation is, we can't do anything about it. The extra £2 billion you've earmarked to the NHS isn't extra at all. It's simply what we need to stand still. The system has been working thus far based largely upon unpaid goodwill from GPs, and this can't continue. Tinkering around the edges of the subject with these little headroom schemes ain't going to cut the mustard. Can you pledge the £2 billion plus the extra £350 million per week saved from Brexit, not into the NHS, but into general practice? Because if you can't, you'll be remembered for being the health secretary under whose watch the general practice sector collapsed, and neither you or us can let this happen.
Okay. And we'll take a comment and a question from microphone 3. Thank you. Yeah, lady in pink.
Is this on?
Yes, it is.
Yeah. Thanks, Mr. Hunt. 3 years ago in this very room, I talked to you about the elephant in the room of overwhelming demand and how we were exhausted and drowning. And it has got worse on your watch, as we told you it would. I, like many you alluded to in your speech, have resigned as a partner to protect my health, and in my capacity of running a peer support group of 8,000 primary care staff, I've watched other people break, and 2 members have sadly killed themselves. I therefore respectfully and professionally ask, why should we believe what you are saying today when you weren't listening then?
Well, I respectfully and professionally profoundly disagree with the sentiment of that question. And I'm sorry that if that's what you think, but let me be clear. I did not say when I was here before that we were going to solve these problems overnight. And I think that if you look at what I said at the start of this speech, I don't think you could say for a moment that I was ducking the challenges faced by general practice. I actually opened by talking about those. But the long-term issue is getting more GPs to do the work that we need general practice to do. And what have I done in the 3 years since I came here before? I have put in place a program to get 5,000 more doctors working in general practice. That doesn't happen overnight. It takes a lot of work. I think I showed you today that we've made good progress on the medical school side, but we need to do a lot better in terms of the retention side. I've announced plans to increase the number of doctors we train across the NHS by 25%. That's one of the biggest increases in the history of the NHS. And I am trying to do everything I possibly can to resolve these situations. But, you know, it is challenging. And what I would say is that there are things that you can do as well. And I think the evidence from the slides that I showed this morning is that you can make a big difference in your own practices. And this isn't going to be something that the Health Secretary solves for you. It's going to be something that we solve together. And I think there is evidence that in many parts of the country that is beginning to happen. But I don't pretend for a moment that it's going to happen instantly.
Thank you very much. Ladies, okay, I've been called, I have to... Yeah, I've just been given the absolute cut-off. We have to close to get you to your next sessions. Ladies and gentlemen, in a moment I'll ask you to thank the Secretary of State, but before we do, there are so many people that were burning to ask questions. What I would like you to do, and this is a promise from me, submit your questions that you were going to ask or say on Slido, or if you're not a fan of the technology, on a piece of paper at the box of the RCGP stand downstairs, and I will write in follow-up to this conference and to your speech to the Secretary of State, putting your questions to him. I'll collate them, try and make sense of them, and we'll publish the response for you all, to all delegates of the conference. You can see what's said. So thank you for queuing up. I'm sorry I didn't get a chance to ask you questions. Thank you very much, Jeremy Hunt, for being so candid, for the big promises you've made today. Ladies and gentlemen, can we give him a round of applause, please?
Thank you very much, Helen. Thank you. Thanks, Richard. All the best. Thank you.